The Mile End Early Diagnostic Centre currently comprises 2 endoscopy rooms, 2 ultrasound rooms, there's a CT scanner here. We also have breast screening here. We have one-stop phlebotomy here. And on top of that, we have X-ray. One of the principles about this particular centre is that it's divided or separated from the acute side of the hospital so that people can have dedicated time for their procedures.
This is a unique concept, the first in the country. A collaboration between 3 providers working together, bringing patients from different boroughs of North East London to be looked after in a diagnostic centre.
And this is for basically the next ultrasound liver scan to be done. If I just run through some dates and times.
At this centre, we're able to offer more choice because we're not competing with trying to give you an appointment with those patients that are also on the ward.
So as a scheduler, my role would be to actually schedule in the ultrasounds and endoscopies just to ensure that patients have their surveillance scans at the regularity they should, and make sure there's good communication between myself and referring doctors to make sure patients are seen within the times they should be.
The Early Diagnosis Centre is right next to the main entrance of Mile End Hospital. You're straight in, so in terms of access, it's wonderful.
One of the things that we've tried to do is to make this one stop so you can have your blood tests on the day, you can have an ultrasound on the day and a CT scan on the day if you need it. We want to minimise the time that you come into hospital to really have value in that appointment. And I think in COVID times this is even more important.
Just to confirm that yourself and nobody else in the same household as you has or has had any coronavirus-like symptoms. Okay, that's great, perfect. You will be given a new face mask and everybody entering the hospital sites also get a temperature check.
This place is unique also in the sense that it provides an environment that is a COVID minimized pathway, and so patients can feel safe coming here.
Every patient is being swabbed prior to coming into the unit, so we know that every patient has a no negative result, and we're asking patients to self-isolate as much as they physically can prior to coming into the procedure. Once they arrive, they're going to have their temperature checked, and also we'll be wearing the personal protective equipment, which everyone now knows as PPE.
They're only allowing carers or maybe someone for interpreting to enter with a patient. We're reducing the number of patients coming in just to ensure there's more spacing in between the patients and also to limit the number of patients in the waiting rooms.
People are always going to be apprehensive, people are going to be nervous. We want to create a friendly environment and explain what they're going to have, explain what the procedure room looks like when they get into there, explain that they're going to have a copy of the report when they go home. So whatever we see or do on the day, they will actually know before they leave the department that day.
We have a Mindray system and all the observations will be put on an electronic record and that will follow through to the endoscopy suite and through to discharge.
We have systems in place to monitor heart rate and blood pressures and oxygen levels remotely so that we can see them from outside the room, as well as being able to kind of work with you in the room as well. Patients that have upper procedures will remain in the pre-assessment area and then they'll come through to the procedure room once they're ready to have their procedure. But if they're having something like sedation, then there will be assigned a cubicle somewhere where you'll be private. So from a dignity and respect point of view as well, this is going to be fantastic. Patients will have a closed environment in which to discuss care and obviously to get results and speak to clinicians if necessary.
This centre has been co-developed with patients to treat patients. We have a patient group that helped co-develop this right from the very start to ensure that the patient experience was at the heart of all that we were doing.